Hi, this is Dr. Nick. I'm the incrementalist here with incremental sites for a healthier business and life.
And I'm Fred Goldstein with Accountable Health, helping you reopen during this COVID pandemic.
So Fred, another week, and gosh, I can't even keep count of the number of episodes, but I guess the hot topic at the moment is testing, and you've got a little bit of personal experience around that, right?
I sure do. It's an interesting situation. Obviously, testing. Had a friend of mine, and one of their kids was at college, and the individual woke up actually one morning. They've been very safe, trying to do things really safely and limiting their groups and only going to grocery stores and wearing masks all the time. And he wakes up early in the morning, nauseous, coughing up sputum, and delirious. So one of the other frat brothers there were about 5 of them apparently staying in this fraternity, said, I think I need to get this person to the ER. Looks like COVID. Ended up through some phone calls realizing delirious, call the ambulance. So they called the ambulance, and the individual goes to one of the major national hospitals, and they get worked up. They're not sure if it's COVID or not, but it might be. So they do a test for it. In the meantime, the individual then comes back out of the ER, has a couple of days of illness and throwing up and things like that, cough and cold kind of symptoms. And then the others around the individual decide to get tested as well, as they're waiting for this COVID test to come back. And on day 3, there's no test, and day 4. And so by day 5, some of the others begin to get tests. And one of them actually uses one of these overnight kits that a saliva test very rapidly gets their response back, and they are negative. The person who spent the entire weekend with them, which is great news. The difficult situation is that this major hospital has now called this young man back and said, we lost your test.
Oh, no.
So now you're on day 6 or 7, and you're not sure if you had the illness or not. So what do? Do you continue to self-isolate? Do you begin to go out? At this point,
have the symptoms resolved at this point, or do we know? What's the story there?
They're feeling better. Yeah,
right.
Feeling better. Never really had a fever that I'm aware of. May have had some sniffles and things at this point, but pretty much probably gone now. They're not throwing up anymore. Right. They're not delirious and thinking they hadn't put their socks on and all that stuff. So as a physician, what do you think?
Well, you're at the point of testing that, given how long that took to come back, you're almost at the point of what's the point? I mean, that's one of the things that's really coming out at this point with testing is, okay, so you do testing, but if you can't get the results back, and, we've seen it extend from 5 days with the big lab companies up to, I've seen 7 and even 10 days. Now you're at the point of going, well, what is the point in testing even? Because you've done your isolation, that would be the period of time. And if you develop symptoms, all bets are off, and everything resets from a contact tracing standpoint, and obviously if you develop symptoms, then you've got to monitor, and, that just resets the clock and confirms it, for want of another word. So it really, what the story for me does is amplifies the point that you can't just test. That's not the answer. You've got to be able to execute correctly. You've got to be able to get the test back in a timely fashion. It's really interesting that the spit test that you described was really quick. Sounds like it was, within 48 hours, 72 hours, something along those lines, right?
Yeah, I think it was 1 day to overnight, 1 day to do it, overnight back, and then that day, late at night, they actually had their
less than 3 days. That's incredible. And by the way, no contacts with anybody, so no risk of spread and all of those other things. So, there's some real opportunity. Obviously, there's shipping, there's costs and so forth. We've got to get better at that. And by the way, from a timing perspective, that test was carried out later in the sequence, so probably a more accurate rendition of whether that individual had, if they had the exposure at the time, because we know that the test accuracy rises to the maximum point for all tests around day 7, 8 of, the point of exposure. If you test on day 1, by the way, your accuracy is 0%, roughly speaking. You might pick up something unusually, but so there's a whole timing thing. So it just amplifies the point that from a business standpoint, what do you do relative to this? I think the answer is, it depends, right? And in the case of this individual, I'd be thinking, well, if I've got no symptoms, I'd probably kick out the duration and say, I'm going to wait it out and, time it out based on the symptom-based clearance to say, I'm now free to go out.
So based on that, would you then take the new 10-day guidelines with 24 hours of asymptomatic and say from point of start, 10 days, and then 1 24-hour asymptomatic, and I'm good to go as he approaches that?
Well, I would just ignore the test because you've, and then at the point that the symptoms resolve, that's your clock. And then you take the duration as long as there's no symptoms occur or reoccur, everything is resolving. And I think you said no fever, no temperature. So the 10 days is the predominant time. Some people go with 14. That's the most conservative. Just to talk to the issue of this extended period of time where people are shedding and actually have live virus. Those, I think almost all cases, if not all cases, are instances where somebody was admitted to hospital. They were very, very sick. Mm-hmm. So that's not the case here. Anything that's mild disease, mild, moderate, we know that it essentially is gone. So that time-based strategy allows them to essentially clear. Now, they should go to their physician. I'm not, prescribing and telling and, so forth. But I think that's, at this point, a time-based strategy works. And I think that's going to be the case. And it's also less costly because you don't have to do the testing.
Absolutely. So last week we discussed the whole 51st anniversary of the moon landing, some positives and lessons learned from that. I know you've been looking sort of at the whole issue of HIV and hemophiliacs and other things like that, and hepatitis C and some of the issues learned around that and how that might apply to this disease.
Yeah, so you go through these cycles. It's very challenging in this current environment where we've got different experiences and, I think people are feeling overwhelmed. I lived through the HIV experience front and center. I trained at the Royal Free Hospital. It was a hemophiliac center of excellence, and it decimated that population. And at the time, we didn't even understand what it was. We thought it was a bacteria. We had Pneumocystis carini was implicated. We had, what was going on? How was it transmitted? And we understood and learned all of that over the course of time. And, it was labeled HTLV3 as an infection. It was a viral infection, and it has some very peculiar statistics or elements to it. And it reminds me a lot of the experience with COVID-19 and SARS-CoV-2. Here's the difference. We have treatments, but we got them slowly because we were learning. We didn't know so much. Look at how quickly we got to SARS-CoV-2 and sequenced it, and we're able to start working on viral, antiviral medications that we had in our bag, and we were working on vaccinations. There's over 70 vaccination trials. This is on super speed. And the two positives that I got is, whilst HIV isn't treated, it is successfully managed, and it's not the death sentence that it used to be. And that's true of Hep C, which, when I was practicing, we were more terrified of Hep C than we were of HIV because there was sort of management principles. Hep C was a real killer, and yet we have a solution. We don't have a vaccine, but we have a solution. So here's the message. There's positive signs. We're doing all of this at speed. There's uncertainty, which creates challenges and people's belief about this, but follow the science, not the politics.
Fantastic. So actually there's some positives to come and think through as we look at these issues and recognize where we are today and how much progress has been made. Obviously a lot of work to do, a lot of simple things we can do to keep ourselves protected, as we've talked about before, but the science is moving forward. Well, that's it. I'm Fred Goldstein with Accountable Health. Thanks so much for joining us this week.
And I'm Dr. Nick. I'm the incrementalist here with incremental insights for better business and a better health.